Yellowjackets, so loosely based on high school girls soccer players whose plane crashes in the remote Canadian wilderness in the winter of 1996. Is that a true story? Someone let me know in the chat. This is where, if I was filming alone, I would go and Google that. One of them is pregnant, and another is leading a sort of prayer cult and overly excited about the baby. All right, interesting.
Why the fuck is this taking so long?
Should we, like, boil water? That's a thing people do, right?
Yeah, that's a good idea.
Oh my god, that's so funny. I think that is excellent script writing to have a group of crashed teenagers, one of them pregnant and now giving birth without presumably medical help around. And the suggestion is, should we boil water? I saw them do that on Call the Midwife. And then they obviously are like, I don't know what to do with the boiled water, but it looks like that's what people do and we'll be able to do something with it. That's so accurate because I feel like that is actually what, I don't know, if I was them, that's probably what I would suggest too.
We need to keep things clean. These are contractions, right? Should we be timing them or something?
Yeah, that last one was just over a minute. Is that long or short? Misty, should I be...
That's an interesting point. Oh my god, I'm not going to be able to stop pausing. When you time contractions, you don't time the length of them. I mean, you can, but the point really is to time how far apart they are. So from the end of one contraction to the beginning of a next one, how frequently are you having contractions? Boiled water for tea and cleaning. Yeah, I know that's what it's for. It's just, I think it's funny for them to suggest it in like, oh, well, isn't that what people do? I just think it's actually very good script writing because it's like something that you would actually have a teenager suggest anyway.
Timing the in-between or no?
I don't know. I need to... Okay, I think when they're this regular and intense, she's in labor, and the baby is actually coming.
Okay, so it should be over soon?
Maybe, but my sister's labor was a day and a half.
No, I can't take this for a day and a half, Ty. I can't. Shauna, you can fucking do anything.
Of course you can do it, and we're right here to help. Right, Misty?
Is Misty like supposed to be the acting birth worker? She just took on that role?
What's happening? Something feels weird.
I can't do this. I'm sorry.
Misty, breathe. Right, okay. Who are you talking to?
No one.
Where's Misty?
Misty, she's just grabbing more rags. Okay, everything is fine.
Yeah, so context is that Misty has been the one preparing to deliver the baby, and now it's freaking everyone out because Misty is freaking out.
I got this. I think it's coming. Is that the head? It's so purple. I think it's the placenta.
Nope. No, it's not. Why is it the placenta? That can't come out neck. Nope. This is bad news. Placenta can't come out before baby. This is a problem.
It's not supposed to come after. What's going on? Should I keep pushing?
Yes, definitely keep pushing, okay? It's no big deal. It's just coming out a little backwards, okay? But don't worry. I'm just gonna touch you again, okay?
Whew. Okay, so someone said placenta first. Is this even possible? The only way a placenta comes out first is something called a placenta previa. The likelihood of having a placenta previa where you're dilating and delivering without having like massive bleeding, like will kill you and or baby bleeding, is, well, that doesn't happen. Like a placenta previa, unless you just like started dilating and immediately delivered, there's no way to do that without everybody just bleeding a whole lot. And the reason is because when a placenta overlays the cervix, that's called a placenta previa. So the placenta, here's your cervix, this is the part that goes into the vagina, this is the part that goes into the uterus is here. If placenta is like this, that's called a placenta previa. as the cervix starts to dilate like that, if the placenta is attached here and those vessels are attached to the top of it, as that dilation occurs, then those vessels where the placenta has grown into the uterus are actually grown into the cervix at this point, and they break. And the more dilated you get, the more of those vessels break. And when that happens, you just have worse and worse bleeding. This is also progressively disrupting how much of the placenta is attached to the actual uterus to exchange blood flow for the baby. So the more dilated you get, not only the more blood are you losing from a hemorrhage, but the less oxygenated blood is getting back to the baby. So I'm sure that it has been described of someone laboring and delivering successfully with a placenta previa, but this isn't just like, oh, there was a study that said breech birth is dangerous and, but sometimes it can be not dangerous. Placenta previa is never a vaginal delivery safe thing. So, and I can't think of a way that you would ever be delivering the placenta first, except that. I mean, that's the only way that happens. But, well, no, you can't move the placenta out of the way. You have to do a cesarean. An abruption, the difference between an abruption and a previa, they're essentially the same thing, but a abruption is when the placenta is coming off the side of the uterus and it's not covering the cervix. So abruption, I guess, is kind of the same thing. It's bleeding from disrupted connections of the placenta to the uterus, but it's not covering the cervix. So it's not, previa is scarier in, I don't know, they both can be really horrific, but a previa is alarming because there's an ongoing process that's continually going to disrupt those vessels. And abruption is usually like a singular event, like a car accident or an injury or just a spontaneous event. But the cervix continually dilating is just disrupting more and more and more. And then you can't get anything out until the placenta fully delivers, which means there's no blood flow because the placenta can't come out until there's no blood flow to the baby. That is a placenta. Her eyes look like mine would look.
The placenta is out, but the baby's still not coming and she's bleeding a lot. Are you sure you're good now? I'm great.
Please don't let my baby die.
Okay, just...
I don't know what's going to happen, but to be perfectly clear, in real life, there would not be a live baby still. So, I mean, the rapidity with which, because if the placenta is all the way out, then the umbilical cord has to be detached somewhere, which means the baby's hemorrhaging. So this is, yeah, absolutely major trigger warning. If you are here and, yeah, I don't know what's going to happen, but there's, I would say in real life, no chance that this is going to result in a living birth.
Push, Shauna. I know it hurts and I know this is hard, but you just need to focus and you need to push. You are so close to being on the other side. And then you get to meet your baby.
Oh, okay, all right. Well, we'll pause for a second for the ads and we'll talk about, so this is from a show called Yellowjackets. It actually sounds like a very interesting concept for a show. I think it sounds like a show that I would actually enjoy watching. I don't know what's going to happen, but there's a Pepsi ad. Okay, sorry, guys. Oh. Someone said, how long is the birth canal? Birth canal is just the vagina. So the length of the vagina is like 2 to 5 inches. But it seems like, yeah, you'd just be able to like pull the baby out, but it doesn't really work like that. Everybody should be getting back from ads now. Yeah, I know. It seems like you should be able to just pull a baby out, but it depends where the baby is. If it's way up in the uterus still, then there's lots of bones and bony pelvis between the baby's head and, or whatever is the presenting part and coming out. If it's deeper in the pelvis, a skilled obstetrician could use forceps or a vacuum, but okay, but a partial previa is a very different thing than a Yeah, so the comment here from Randy is 69 documented cases of placenta previa were managed at the Mount Sinai Medical Center during a 5-year period. Vaginal delivery was attempted in 6 instances of a partial placental previa and was successful in 5. Partial placenta previa, very different than complete placenta previa. If the placenta is coming out first, this is a complete placenta previa, and I would be hard-pressed to find a case report where, in the absence of just a incredibly precipitous delivery that did not result in major morbidity and death for one or both of the involved parties. You can't push on the stomach. So this is a common thing that people wonder is, can fundal pressure pushing up here help move the baby down? It actually doesn't, and it can be dangerous. This is fairly accurate. She's incredibly pale, and I'm going to be surprised if this doesn't have a bad outcome. Trigger warning for anyone who's just joined. This is a traumatic birth scene and likely will be trigger warning for stillbirth and or maternity. There was a whole hallucination plot for Shauna and her baby, but here's what happened in the end. Whew, okay, wow, that was a lot. So, in seeing what happened there, I can now definitively say that what I was guessing in the beginning is what happened. So, I don't know all their names, but she had a placenta previa, and she went into labor and started dilating. The more she dilated, the more bleeding she had, which means she was hemorrhaging, and also the baby was hemorrhaging, and also the baby was not getting a return on the oxygenated blood. As that happens, then the placenta delivered completely, meaning if the placenta is all the way out and not attached to anything, then the umbilical cord has broken at some point between where it attaches to the placenta and where it attaches to the baby. This means that within seconds, maybe a minute, the baby would bleed out and not make it. So that is what happened. People are asking about this in relation to real life and when a placenta previa can be diagnosed. And yeah, I do want to say, like, in real life, usually placenta previa is manageable because if somebody starts bleeding, then we would deliver. But this is a situation that we've talked about a little bit in regards to someone who has a previa and has a bit of dilation and is hemorrhaging and has a baby that's not viable yet. And with regards to things like abortion laws, what does that mean? And this is a situation that could be really dangerous. It is actually quite remarkable to me that with the time that elapsed between labor starting and the amount of bleeding that they were having, that she's alive too. So that's, I mean, you can bleed very quickly. The uterine arteries, which come into the side of the uterus, in a pregnant uterus, deliver 500 milliliters of blood per minute to the uterus. So active rapid hemorrhage means you're losing your entire blood volume fairly quickly if there's some kind of situation that's not being intervened upon. Yeah, that's fine. I'll tune in for the next live. Can't watch any more traumatic birth. That completely makes sense. I do not blame you. That one was heavy. That was a lot. All right. Sorry. Yes, the bird sounds are real. Let's see. Someone said, let me look at questions. Does a placenta stay in one spot? I'm 29 weeks, have an anterior placenta. They stay in one spot, but sometimes when a placenta is called a previa at 20 weeks, actually more often than not, if you get a ultrasound at 20 weeks and it's a placenta previa, more often than not, it will not cover the cervix anymore by the end of the pregnancy. But you wouldn't have an anterior placenta and then it suddenly like move down and become a previa. Let me explain why. Previa means it's overlying the cervix, but at 20 weeks, if the cervix is here and the placenta is here and it's overlying it like that, as the uterus grows, because the placenta stays where it's implanted, the uterus grows, the placenta can move up away from the cervix, but you'd never have a situation where one that was implanted well away from the cervix suddenly was covering it, if that makes sense. So it doesn't actually move, but the uterus gets bigger and the distance between the uterus and the placenta can increase. That sounds like a lot. Doesn't the human body only have like 5 or 6 liters of blood? Yeah, I think the average non-pregnant volume is like 5 liters and 6 liters in pregnancy. Your blood volume and your plasma volume increase in pregnancy. Did that answer all the questions about placenta previa and all of this? Let's see. The bird sounds and clicky keyboard are great relaxation. I can just do ASMR streams instead of, boring you to death with talking about all the things that I tend to geek out about. Yeah, and a partial previa is very different than a complete previa. I mean, both require a cesarean to safely deliver, but usually if you have a complete previa, especially if you've had any bleeding, you're going to need to be real close to a hospital for your whole pregnancy. Is it possible to catch blood loss if it's coming out of a known source and use it as a feed back into the body? Yeah, that's called cell saver, and it's commonly utilized for people who are Jehovah's Witness or have another reason that they would not accept a blood transfusion if they are expected to have a delivery that is a surgery or something that could result in massive blood loss. It is a bit harder to use in pregnancy because blood is combined with amniotic fluid and all kinds of stuff, but it can be used in pregnancy as well. Wouldn't that blood be dirty? Yeah, so it doesn't go right back into somebody. So this is what the machine looks like. So see all of these things in here. It's got lots of technology for it. And I'll show you there's a good article, on Science Direct. And the blood is collected and washed with normal saline, then concentrated to make a unit of blood, which includes a certain percentage of red blood cells, and then it can be stored, and it's not immediately fed right back into the patient, and it's also cleaned, to my understanding. But I am absolutely not a hematologist. Yeah, here we go. So used in many surgical specialties, particularly for patients who are Jehovah's Witness or otherwise would refuse to have a blood transfusion. Increasingly used around the world with 400 case reports in the literature. And then I was hoping that would talk a little bit more about how it works, because I'm not actually 100% sure what the process of cleaning it is. So suctioned to a reservoir with heparinized saline, which is to keep it from clotting, into the cell saver machine, washed with saline. There's probably some sort of really advanced filtration technique that's used, especially in obstetrics. There would have to be.